My name's Afua Hirsch. I am the social affairs editor at Sky News, but I, as well as being a social affairs reporter, also cover West Africa and have a lifelong interest in West Africa. So I've obviously been following the Ebola crisis. I'm really pleased to welcome a very distinguished panel today. I'll just introduce everybody. On my far left is Tulip Mizuna. She is the global health correspondent for the BBC. She's going to be showing us some of her work on Ebola today. She's been covering the epidemic since the beginning and has been going back and forth to West Africa to cover what's happening. Next to me is Julia Streets. She is a businesswoman, a writer. She told me not to say this, but a comedian as well. And she's the trustee of a charity called Children in Crisis. So they've been doing work in Sierra Leone and Liberia. So she's going to talk about the role of education in looking at the gendered aspects of the impact of Ebola. On my right is BC, sorry, and I promised to call you Olabisi, your full name, Olabisi, as your listeners in Sierra Leone know you from your radio show. Olabisi Garrick from Media Action, and she is based in Sierra Leone, so she's been very involved in the evolution and development of this crisis. She's going to be telling us about her experience and about the challenges for women accessing justice in the issues that arise from Ebola. And last but not least, I'm really happy to have Precious Lunga with us. Precious is an epidemiologist and an entrepreneur, and she has been using mobile phones to reach women in rural areas and help them access health services. She's worked with the UN on disease outbreak work and on Ebola with the African Union. And she works for a company called EcoNet Wireless, which is part of Africa Against Ebola, which is an alliance of businesses that have been countering the effects of Ebola. So she's going to talk about the role of technology in helping women who are affected by Ebola. So what I'm going to do is invite Tulip to give a keynote talk. She's going to speak to us and, as I said, show us some of her footage. Each of the other panelists is then going to speak briefly for 3 or 4 minutes, they've assured me. We will have a panel discussion about some of the things that have come up, and then I'll open it up to the floor for questions. So as always, do think about your questions as you're listening. And I hope that we can make this a really interactive and fruitful discussion. So without further ado, over to you, Tulip.
Thank you, Afua. Hello, everybody. Thank you for coming. It is excellent to see so many people here. I remember when this Ebola outbreak first started, although at that point we didn't know it was Ebola, we didn't know it was an outbreak. It was sort of mid-March time, and I started hearing about a cluster of mysterious deaths in a remote part of southeast Guinea. Nobody really had their antennae up for Ebola at that time. The virus had never come to this part of Africa. But by the end of the month, it had been declared there was an Ebola outbreak by the World Health Organization. There were around 50 deaths at that point. Since then, I've done about 5 trips to Guinea and Sierra Leone, and I've seen this thing, as many of us have, and in the audience as well, balloon from this sort of smallish outbreak. There have been others before. This was expected to die out like those had done, to, you know, an unprecedented outbreak, to this enormous, you know, biggest, worst health crisis in modern times, as the World Health Organization has put it. And I think if we could just briefly, I'll just talk about, you know, why has it been able to develop the way it did? These were perfect conditions. Ebola almost couldn't have found a better place. It was on the border with 3 different countries. It was in 3 countries that had had a lot of problems coming out of civil war, very poor. The health systems were extremely weak, and there was very little infrastructure. You know, if you've been to some of these areas, I've been there, you know, no roads. Even if people wanted to get help, it's very difficult to get to your nearest hospital, if indeed it exists anywhere close to you. So that helped. And then it's also about what Ebola is and how it spreads. The vast majority of people who've caught Ebola have caught it from their loved ones. So many health workers have been infected, and that's because it's passed on through people when they're caring for others. So, you know, when their sick child is lying there, when a mother takes the sweat off her brow, she's potentially infected. It's passed on through body fluids. When you're doing your final rites for your mother or your father who's died, and such an important part of that is washing the body. Well, Ebola bodies are very toxic. It's passed on through that as well. So there was that. It's a sort of insidious virus. And then there was the fear that really spread that. And that is something I remember experiencing the first time I went. I went into Guinea, I went to Gekadu where this first started, and I went into a village and I felt it, you know, and fear is contagious, and people were terrified, and people were hiding their sick loved ones. And that is how, another reason why we saw this balloon the way it did, because when people hid, their families looked after them, their families became infected, they then potentially went into hiding instead of trying to get help. So I'm going to show you a report from, this was when Sierra Leone was probably at its worst state. It was in October time. Yeah, let's have a look at that now.
In Spain, health officials have confirmed that a nurse who treated 2 people who died of Ebola has herself tested positive. She's the first person in the current outbreak known to have contracted Ebola outside Africa. The head of the new UN mission to deal with the Ebola crisis has told the BBC that time is fast running out to bring the outbreak in West Africa under control. The outbreak right across West Africa has killed more than 70% of those infected. More than 3,400 deaths have been recorded, though the actual number is thought to be much higher than that. But what concerns officials is that after a relatively slow start, the rate of infection increased dramatically from July. Sierra Leone is one of the worst affected countries. Yesterday brought news of 120 deaths within 24 hours. Our global health correspondent, Tulip Mazumdar, sent this report.
Francis Samuka has been sick for 4 days. His bloodshot eyes, a classic sign of Ebola. His family have brought him to this treatment centre, but it's full, so Francis is told to go home, putting his family and his community at risk.
And then we called all the different hospitals, there is no treatment. So what is the government doing for us? We are dying, people are dying. What is the government doing for us? We don't know.
Francis's family is now potentially in grave danger. They had nothing to protect themselves.
Just press it into your hands and wash. And 5 gloves for all of you.
Ebola is passed through close contact with infected people. Their sweat and other body fluids carry the virus.
The family are leaving now. They're not sure where they're going to go to yet. They are completely and utterly bewildered. They've been told that a health worker will come and see them, will come and assess them in their house, but they are frankly very sceptical of that. They are afraid, and they are heading towards a very uncertain future.
Medics here are having to turn people away every single day. It's a heartbreaking choice.
Of course, for medical staff it's not easy to say a person, I'm sorry, we cannot admit you. But speaking about Ebola, the safety of all national and international staff is the first priority that we have to think about the facility.
It may not look like much, and staff have to work in extremely difficult conditions, but these centres are saving lives. Every day, medics carefully handle toxic blood samples. It's painstaking work. In the midst of all this frustration and sadness, a ray of hope. 3 girls have been given supportive treatment here, and they've recovered. Across town in the city's main cemetery, burial teams scramble over fresh graves. Hundreds of victims have been laid to rest here. One of the latest is a man found dead on the street. No one even knows his name.
15 bodies have been buried here today alone. Many of the graves are unmarked, but some, as you can see, are marked by simple palm tree leaves. Burial teams here are utterly overwhelmed, but there are warnings that things are about to get much, much worse.
Cases in Sierra Leone are rocketing. More than 120 deaths were recorded yesterday alone, making it one of the deadliest days of this outbreak so far. Tonight, there's yet another death. Francis's family called us this evening to tell us he has passed away. Tulip Mazumdar, BBC News, Freetown.
Yeah, so sadly, we happened to catch that on camera, but that was happening on a pretty big scale at the height of this outbreak. Just so you know, we subsequently found out that Francis's father had passed away. They were reluctant to tell us about whether it was Ebola or not because of the stigma attached to it, which I'm sure we'll talk about. And his sister, who you saw there, who was shouting, very angry that they weren't getting help, she also contracted Ebola, but she survived. The next report I want to show you is just from my latest trip in January, and this is sort of moving on to some of the gendered issues. Women have been impacted in a different way to men, although the split between the number of men and women who've been affected is pretty even, actually. But with maternity services, pregnant women are at particular risk. We heard about cases of pregnant women being left to give birth, bleeding on their own in hospital corridors because they were bleeding. Nurses wouldn't touch them. It's one of the signs of Ebola, obviously. And to be fair, there's a lot of virus in the fluid, and many health workers became sick that way. But this next report is about the high risk to pregnant women and how very, very few. The death rate for pregnant women is almost 100%.
The latest figures show that more than 8,000 people have died from Ebola in the current outbreak in West Africa. The death rate among pregnant women is extremely high, almost 100%, according to the French medical charity Médecins Sans Frontières. Our global health correspondent Tulip Mazumdar has been given exclusive access to the first ever centre specialising in care here for pregnant mothers. It's in Freetown, in Sierra Leone, where she met one of the few pregnant women to have survived Ebola.
16-year-old Lamatu is one of only a handful of women who has survived Ebola despite being pregnant.
Thank you very much for talking to us today. We appreciate it.
But this is not her baby. Lamatu miscarried while she was ill. Now she's caring for this little girl, who is extremely sick.
I had a cold at home, and my joints were aching. My father knew he couldn't keep me at home, so he sent me here. I was bleeding for 2 hours. No one would touch me. After the bleeding, I was put on a drip. I started to feel much better. Now I am recovered.
Unfortunately, pregnant women are very at risk from dying of Ebola and complications related to Ebola. The prognosis for the babies, for the fetuses, is terrible, and it seems to be a concentration of the virus in the fetus.
On the other side of the capital, a new MSF facility. As well as taking Ebola patients from nearby villages, it will also specialise in caring for pregnant women who could be infected.
Not one unborn child has survived from an Ebola-positive mother, according to MSF. It's hoped this first dedicated maternity unit will help change that.
Health workers are also at particular risk when delivering babies because of the high volume of infected body fluids.
The delivery moment, it's so high contamination moment that we need as well to take care during the delivery for the health staff as well. Or sometimes to have extra protection, like an incubator, when you put your hands in the gloves, then you can do the delivery, or you can really accompany the mother without exposed by some liquid by accident in your skin.
Back with Lamatu, and she is well enough to go home now. But she won't leave little Mamusu, whose condition is deteriorating. Tulip Mazumdar, BBC News, Freetown.
That was probably the hardest report I did out there, actually, that one. You know, I mean, obviously there were some quite difficult situations, but that baby was beautiful, and we found out a couple of days after, unsurprisingly, sadly, that Mamusi passed away. Now, I mean, I've given you a picture there, and of course, you know, we all know this is tragic and terrible. We are coming to a much more positive place, and amongst all of that sort of sadness and tragedy, I also met so many brave, resilient, determined, incredible people who were going into their own communities and helping people, helping turn this around. And in the end, what we've seen in Liberia discharged its last Ebola patient yesterday. And that's because the communities themselves, listening to radio programs, listening to people within their own communities, have got the message, understood Ebola, and done some quite tough things, you know, changed their behaviours, changed how they buried their loved ones, changed how they look after loved ones, which has been really hard. And actually this is starting to turn around. So we are in a much better place. There are some real heroes, West African heroes out there working on this, and that is why we are hopefully, all being well, coming to the tail end of this outbreak.
Thank you very much, Tulip. Really powerful and difficult to watch, but I think we're all really glad you showed that to us. So thank you. I'd like to move next to Olabisi. Before I do, I promised and I forgot to ask everyone to turn their phone off. There haven't been any phones ringing, but I've just been reminded that could you please all just triple check that your phone is off. Thank you very much. Olabisi, over to you.
Thank you very much, Afua, for, you know, bringing us to this forum for us to talk about something that is, well, we thank God we're almost beating Ebola in Sierra Leone now. Like women all over the world, Sierra Leoneans, women strive very hard for recognition they deserve as equal partners in the running and development of our beloved country. Whether it's as a student or being a professional, just simply as people going about their everyday business. We've made progress, but we still have a way to go. However, what we didn't see coming was something that has further eroded our status, and that is Ebola. Being forced to stay indoors has created tension, frustration, and our women have been on the receiving end of it. We've seen a sharp rise in sexual violence, an increase in teenage pregnancy, and have even been told we can't inherit a dead husband's property because he died of Ebola. Added to this, it is our women, our traditional partners, who prepare the dead for burial most of the time. They carefully and lovingly wash the dead, as their mothers, grandmothers did, but even that has not stopped. It's too dangerous to touch the corpse of a dead body that's infected with Ebola. At BBC Media Action in Sierra Leone, we've responded as we always do by using the power of the media to help spread the message, to help sensitize them about the deadly disease that we're faced with. Ebola, it's for real. There was a point wherein Sierra Leoneans, you know, because of the level of literacy, they thought Ebola is not real. You people are telling this, you're telling us it's Ebola because you want to get money from somewhere. You know, just this myth of negative perception circling around Ebola. But BBC Media Action, most importantly, we try to give them the ability to discuss everything and ask the hard questions around Ebola. My latest roadshow comes in two parts. The first is Bamba Community. It's a radio drama that follows the lives of women and the issue we're faced with in terms of violence, unequal treatment in everyday life, and the legal and justice system not taking us seriously or dismissing us. As we've heard from Tulip, Ebola is for real, and amidst all the issues around Ebola and the threat it poses in our socioeconomic development, still issues around abuses keeps increasing. women and girls being raped. And this is like, why is it going on? We don't know. The questions are still yet to answer. The roadshow follows discussion program where I ask listeners to call. They talk about issues around sexual gender-based violence that is burning them in there, and seek advice from panelists. Legal aspects, we have professionals, government officials in the panel as well. It's my aim to show women and their husbands, fathers and brothers, that they have rights, that they can demand them, and that they can access the same justice system. Sadly, our 2012 legislation that made sexual violence illegal hasn't had a chance to bed in, and Ebola has taken out our lives. The police stations are shut and the courts are closed, but still insist that women and girls must not accept anything but equal treatment. Here's the opening tune from the radio drama. Indeed, from that, it's from a local language, and it's about, let us know, women are suffering in Sierra Leone. Decisions are only taken by men. What about the women? Don't we have voice? Can't we speak for ourselves? As you can see in the picture, that's the First Lady. Because we need her to champion this particular cause that we're doing. And so she's very much involved into the new program we're doing that has to do with justice and security for women and girls. And the two other women flanked on the other side are two key characters, two main characters in the drama. In all, we're saying that amidst the Ebola, there are a lot of issues surrounding violence, abuse around our women and girls in Sierra Leone. So we need to raise their awareness. We need to develop their confidence. And we need to tell them, women, until we start talking about these issues, it's not going to stop. We need to talk and talk and talk. I thank you.
Thank you very much, Olabisi. Thank you for that. And Tulip and Olabisi have both already raised issues that I hope we'll come back to in our discussion. But before we do, I'd like to move on to Julia, who, following on quite neatly, I think you're going to talk about the role of education and the impact on education.
Yeah, delighted to. Well, first of all, thank you very much for. It's a full room. I gather the event was completely sold out, which is phenomenal. So I'm in addition to being an international businesswoman and everything else that I do, I'm enormously proud to serve as a trustee of a charity called Children in Crisis. Very briefly, what we do is we go into the very hard to reach post-conflict countries, and over 21 years we've been into to many of these. We've reached about 1.4 million children and their families, and it's all about kind of looking at creating sustainable education processes and programs. And the reason why we believe that is because a chance to learn is a chance in life, and we look at not only starting with the children, we look at the communities, we look at adult literacy, we look at vocational training and enterprise, and we'll come on to that in a little while. So, but we're not arrogant enough to sit in London and just go, you know, kind of, we know what you need on the ground. We're very proud to work with local partners. That's our model. So we've been working with the Forum for African Women Educationalists in Sierra Leone, and that's a very positive endorsement. I don't think you can get a better endorsement than that, actually, so I'll take that. Yeah. And we've been working with them in Liberia and in Sierra Leone, and it's no coincidence that it's the women educationalists. During the times of a conflict, it was the women who realised, while the men folk were out fighting, that the children and the communities require education for a brighter future. And so we've been working with them since about 2001, 2004. And so it's very interesting for us because we're very committed. I was out in Sierra Leone, and let me just paint a quick picture. I was out in Sierra Leone in October 2000, and where are we? 13. Gosh, time flies, doesn't it? And I have to say, so I went out, I paid for myself to go. We don't get the charity to pay for the trustees, just to be clear, in the interest of disclaimer. I went out and I basically arrived in Freetown, went out into Cambia Town, and went out into the rural communities and into the schools. And the first thing that happens when you arrive in a school community is you just get mobbed in the most beautiful way by just children who are all desperate to learn. And you go into the schools, and if you imagine a school is basically a bench, say the length of this, and on a bench, well, actually take the two of us, you've probably got about 6 children lined up, and you've got banks and banks and banks of children all desperate to learn. And we look at who's in school and we look at who's not in school. So we look at, for example, children with disability and how do they get into schools. And then Ebola hits. And what happens when Ebola hits is the schools don't open, the markets don't open, the courts don't open, as you were saying. And so we had to ask ourselves some very deep searching questions, because we have sponsors, we have donors who support our work. And suddenly to be able to say, well, actually, the schools aren't open and we can't teach. And we also have a commitment to Farway, the forum that we work with our local partners. And you can't just say, well, I'll tell you what, call us when the schools reopen, won't you? Because we are responsible for the livelihood of teachers, and we're responsible for the livelihood and the future of children. So we had to ask ourselves some very deep searching questions, which is, what is education? And I think the points that were made earlier are really, really important about fear. And because we have these relationships with local communities, rural communities, I mean, I drove for hours to go into these amazing, amazing villages, that when you walk out there, you hear these stories about people being so fearful of the information they're being given, and understandably, that actually when you're working with someone like Farway, you're a trusted local partner. So you can go out, and so what is education shifted into what is protection education, what is sanitation education, what is community around Ebola education, and changing our programs there. Now, we said to every single one of our partners with Farway, we are not going to insist that you do this. We're not going to insist that you go out and take on this role, because you're probably scared too. And we are just bowled over by the response that we had, which every single individual we work with stepped up and said, this is the job we want to do. We want to go out into those communities, and we want to, in many respects, you could argue, put themselves at personal risk. And we could come out, I know all this stuff is going to come out anyway, about the role of women as teachers, the role of women in burial rites and traditions. So what we're now doing, and you talked to the positive, which is the schools are reopening, which is incredibly exciting. And we're spending time now thinking about, well, what does that mean? Because it's not just about going, all right, crisis over, everybody back to school. It just can't work that way, because you have to remember that there are children who have been through extraordinary trauma. You know, there are families who have lost children, who have lost support units around them so that they can to collectively let their children go to school. And I keep talking about the children, but let's also not forget adult literacy, adult education. Imagine, this is a beautiful way to describe to me this week actually, was, imagine you're 31, okay, and you're in Liberia, and your education probably started at the age of 6, and then it stopped because of conflict. And you probably picked it up again when you were about 21. And then you finally get back on a track. So as a young woman, you're getting back on track. You may well have some children of your own. And you're probably learning skills, because that's what we're focused on doing, is helping these young women build skills. So through tailoring, baking, enterprise. And then Ebola hits. And you have to sell your sewing machine. You have to sell every asset you possibly own in order to survive. And these are really real challenges. So what we're looking at the moment is partly is what's the role we play in helping the schools reopen. And there are lots of issues around sanitation, cleanliness. There are some which we think aren't necessarily entirely practical, because as I said, if you look at the benches, they are rammed with children, and there are questions around spacing of students. Well, we say welcome everybody, but of course, you know, in that context, we have to be very, very careful about how that works. We have to think about, you know, kind of young women and how do we get them back into enterprise. And one other example I was told about this week, because we talk to the field all the time, our local partners, is about women in Liberia actually making their own soap. And because part of this is about cleanliness. So actually getting into soap making industry. So you're not having to import it at great expense. You're actually getting it yourself. And then also thinking about the teachers. Now the teachers, then we may not have as many teachers as we had before. That's the reality, and many of these are women, and many of them are men. And by the way, actually, we don't see, this has been horrific for both genders. Let's just get that out of the way. But actually, and for women and for teaching as well, which is, as I mentioned before, they may not have the support networks that allow them to go back into teaching. So these are some of the really big questions that we're looking at the moment.
Thank you. Saved me passing your notes. That was a substantial introduction, but very interesting. And again, more that we'll pick up on. I just want to come to Precious. I should say as well, if you see Precious walking out just before the end, it's not because I've offended her or anyone else in this room. She has to go, but we've got you for a bit longer, haven't we, Precious? Could you just tell us about the role of technology and the way that you see that's impacted women dealing with Ebola?
Thank you. It's watching those reports, it never fails to affect me or affect anybody who works in public health or epidemiology. And that's because you will always have disease outbreaks, but they don't have to become epidemics. And so when we see that footage, we see failure. We failed to put the systems in place which would have stopped that one family in Guinea from that disease being a tragedy in that one family to a disease that has affected 3 countries and beyond, in fact. And part of that is with a big gap was in the follow-up. There was no information, a big information gap. We saw there that family, the caring family who put the sister put the brother to travel to a clinic, but then you get there and the clinic is closed, and it probably close to them because it's full. And in that time, they're interacting with each other in a closed environment. They're meeting people along the way. They had a car. There were many who traveled on public transport. And the question that we ask is, could we have used technology differently? What if we'd been able to phone a short number, a code, where we could find out which places are open, where we can get that information? That was a failure in our part, because even now as we speak, I can phone many places in Sierra Leone and connect to someone. So that infrastructure is there. So why did we not use it? And that's a question that's been asked. We're now starting to do something about it, to put the systems in place, because we have to remember that we want to deal with the current epidemic, and we want to make sure that there will not be another epidemic. Because we know from what's happened, if you see what happens with Ebola, for example, in the Democratic Republic of Congo, is that they now have a system in place, so you have an outbreak and they can just stop it from spreading. And this is what needs to happen. The trajectory is going the right way, but until we have not a single case and we pass the requisite period, we can't be complacent, because we know that epidemics will spike. We have seen a decline before and then an upsurge again. And part of that is, okay, so how do we use the technology? Women, we need more women with access to phones. Even now, a woman is around 20% less likely to have a mobile phone than a man. That's not right. We should use this as a chance to leverage on the fact that we need women to have access to phones. The phones aren't just going to be for communication. We have to also think beyond. What about livelihoods? We know that mobile telephony increases economic productivity. And in order for the countries that have been affected by Ebola, in order for them to start to rebuild the economy, because the impact there have been more than 20,000 people infected, but many, many more affected. And it's now about, okay, let's go into the solution mode. Let's start to build. Let's introduce services or expand services that will enable pregnant women to have access to information throughout their pregnancy, on warning signs, on what they should do, because this information can arrive in their home so they can call someone, they can get the information. And again, we know that we don't have that many health workers. There were not many in the first place, there are now even fewer. So let's leverage on that technology so we can develop. In fact, it's not about developing, the technology is there, the apps are there, the information there, and the next step is really partnering with organizations that are going to make sure that the phones are in the women's hands, be they pregnant women, be they girls, so that they can have access to that information, because information is also power to prevent catching Ebola, power to prevent dying from malaria, because many people are actually suffering from other diseases as a result of Ebola. And again, it's that information gap can be closed. We have the technology, we have the information. Let's start implementing policies and activities now in those countries that will actually make sure that women have access to the phones, because that's how they're going to have access to services, financial services, health services, and education.
Thank you so much, Precious. And thank you, everyone. So I want to just start our discussion by throwing up a question. Well, it's two questions, really, to all of you. One, how much do you feel that there was a recognition early on, or a critical point in this crisis, that women were particularly affected more than men disproportionately? And two, do you feel that if that was recognised, if it is recognised, has this created an opportunity for the gaps, the failings that you've all talked about to be addressed in a way that puts women at the heart, so that we actually reach a post-Ebola future that's better than the pre-Ebola future? I don't know, I want to ask you, Tulip, I mean, did you feel as a journalist that there was a recognition, were ears open to the stories you were hearing about women affected, and was that a big part of it from your perspective?
I mean, just looking at the numbers, if you look at the numbers of people who have died from Ebola, and sadly we're reaching the 10,000 mark now, it's pretty evenly spread in terms of death, the number of people and the number of infections. I think it's more the diseases around it. So, you know, you mentioned malaria, people were suffering for that, and for women, it's obviously around maternal health, and that was a real problem that wasn't dealt with during the epidemic. Now, nobody's got specific figures, and I don't think we'll ever get them, but it would have been in the thousands. Thousands of women died giving birth, or they miscarried before the birth, or they died soon after, or the child was stillborn, because they didn't have the maternity services there, because either people just weren't turning up to work anymore because they were so scared. So many health workers have died in this outbreak. Or they were there, but the woman was, like I mentioned before, you know, bleeding, waiting to be seen, and everyone was too scared to touch her. Now, that was an information thing, because, and so the consequence of that was women wouldn't even bother going into hospitals. They'd just stay at home, and they've got even less chance. So I don't think that was well dealt with during the epidemic. I think there's quite far to go now, you know, now that we're hopefully reaching the end of it. What next? Because the health systems have been completely decimated. They weren't great, far from it, to begin with. And now they're non-existent. So for women, you know, giving birth, this is a big problem. What happens to them? There is still this fear. You know, what's the answer for them?
BC, do you see this as an opportunity to redo things better than they were before, for women especially?
Yeah, very much so. To add to what she was saying, the other thing why we see women are more infected and affected as well, women are mothers, women are caregivers, and to see your child lying down there sick, there's no way you're not going to touch her. So that's the most difficult area. And that's why, you know, amidst the pregnancy and all of this, that also was another effect that we realized that they can't just let it go. The issue of acceptance wasn't coming in. There was no way they're going to accept it, that it's Ebola and I don't need to touch it. And it's an eye-opener now that, you know, Sierra Leone and the government is also working very hard to see how we can even have specialized words, that things that will, you know, like if you want to check whether someone has cancer, you need to fly all through Ghana. We don't have those simple machines in Sierra Leone. So they are working on it now as we speak to see how they can revamp our health system. Indeed, it was weak, it broken, and it just exposed Sierra Leone as a country. So it's an opportunity now that we're building on to see how we can revamp it, how we can improve on it and make it more better for even, not even women and girls, for women, men as well. So that, you know, whatever situation you're faced with, whatever disease you're faced with, there's a way that you can run to first before taking a second step. And like she was saying, Congo had to work and had a better system now, because after the Ebola outbreak, it's like, oh, an eye-opener, we need to do something. So it's the same with Sierra Leone. It's new. We're not hoping it's coming. Never. No one ever dreamt we're going to have Ebola. But since it came, we had to deal with it and see what we can do. And that's what we're doing now, putting all modalities in place to see that we have the right structures. In the event it happened again, we're going to attack it.
I have to say, I was in Lagos and the Niger Delta during Ebola, and I was amazed at the effectiveness and efficiency of Nigeria in taking people's temperatures, in sanitizing. It was a level of efficiency I've never in my life seen, especially in Lagos. The fact that they were able to control it, you know, defied expectations. And reminds me of what you were saying, Precious. It's as if there is this capacity that I think sometimes we underestimate. But yet, you know, the mobile phone technology and penetration is there, but we're still not quite using it the right way. It's quite frustrating.
Yeah.
And do you? I mean, what needs to be done differently? People have phones. There's an understanding that this is information that needs to get out there. Why didn't that happen? I mean, you asked the question. Do you have an answer?
I think at some point there was a panic. People didn't move, but actually it is happening now. I know that in the sort of the 3 countries that we're using mobile phones to track people who have Ebola, to provide information, and actually the information dissemination is actually going to other countries in Africa as well, so to reduce the stigma. So we're slow, but we've actually started down that path.
And Julia, I just want to come to you as well, because again, what you were saying about schools is obvious areas for improvement. I mean, obviously this is down to resources. Do you feel optimistic that things can be done better now? I know 6 children aren't sitting on a small bench because they want to. It's because there are more children than there is space and not enough money. What's your prognosis for the future?
I think one of the things we have to focus on in the short term is getting children back to school. So there is still a lot of fear around wanting to come back into schools for fear of catching Ebola again. The stigma you talked about, actually, about children coming into a school where they have lost family members through Ebola, there is a lot of stigma around that. I think we're very encouraged about kind of almost shining a light on how appropriate the schools are to deal with children in terms of their sanitation. And I touched a little bit about sort of children with disability. You know, the reality of children with disability is that they quite often need carers. Quite often the toilets aren't sufficient. They don't work for somebody who's in a wheelchair. You know, all these practical, the schools don't have enough ramps. That's kind of what we were dealing with beforehand. And then now, if you take requirements around greater sanitation, you know, be able to have areas to wash and keep clean, it does shine a light on what is the infrastructure that's required. But also in terms of education as a tool, And education is a tool for healing. Education is a tool for helping children get through, or families, actually communities, get through the trauma. As you said, extraordinary stories of just incredible heroes, actually, from the field. You know, and communities that have really kind of rallied together and fought Ebola because they haven't had access to and be able to physically get to centres, etc. And I think education plays a really interesting role if it's done in the right way. And we're kind of looking at surveys of thinking about what do the children need, what does teaching look like, etc. So we're really hopeful. We're very, very positive. I think at the moment also there's another interesting thing, which is we don't really have the data. We don't have the data at the moment, but as I say, part of these surveys, we're looking at that. But I think it's also an extraordinary opportunity, if I could look at a cloud with a silver lining, is about looking at the Ebola outbreak and thinking about what have we learned from it individually, collectively, technologically, in terms of services, infrastructures, and really using that information for the better as well.
It feels really good to be able to talk about it almost in the past tense, doesn't it?
Almost.
More than a few months ago, at least. I'm conscious of being greedy and hogging the question, so I'm going to open up. We have only got about 10 minutes left, so please keep your questions concise, and I would prefer questions rather than comments, because I'm sure you'll be able to, apart from Precious who has to dash off, if you have any kind of comments you want to make, you can grab us afterwards. But let's keep it to questions so that we can keep a discussion going. So can I take any questions? Yes, please. Could you introduce yourself as well, please?
From a health point of view, do we know if Ebola virus is mutated?
That's a good question.
Because it seems just, I know what you're saying about lack of communication and education, but it just seems to have impacted so quickly this time round.
I would direct that, I think, to Precious.
It does mutate, but the reason why it's impacted in this particular way is, as we said, it was the perfect storm, because you have mobile population and who really didn't know anything about Ebola at all. So with the original outbreak in the Congo, which happened in the 70s, it was an isolated village somewhere. And so when there was an outbreak, they literally actually ring-fenced that village and people couldn't travel. So they were able to understand it in an isolated, with an isolated population and stop it. Whereas this happened along the border, and it also, the original, we think that actually the original outbreak was this family that had bushmeat in December. So Christmas time, people are traveling. So there was a confluence of factors that actually sparked. So the spark became a big fire.
Yes.
Hi. Really interesting. Thank you very much. I wanted to ask about the children who have lost, obviously, their parents through Ebola, and I'm assuming that women will take on that primary responsibility for caring for children from their extended families and communities. In Liberia and Sierra Leone, is there a recognition of women's important role in that, and is there any support for them to do that role?
I want to direct that to Olabisi and Julia, and I had a question of my own, which is that I've also heard that charities have been giving money to extended family to take on children, but there's still a lot of stigma, and sometimes that hasn't been done.
Yes, indeed. Firstly, the government of Sierra Leone, they had a ministry that deals with women and children, and so they are like the first spot that looks at these kids, and a whole lot of other organizations that deals with women and girls. They have safe homes for them, and presently, as we speak, they're trying to renovate more homes and build more structures so that these kids wouldn't be, in areas where they are being stigmatized, but they want to take them in safe places where they can counsel them gradually, because we know psychologically it affects them as kids, and losing both parents, it's so devastating. So they are really working on it, and we have women organizations who weekly, monthly do send out gifts to these women and girls, to the ministry, so that they can take look after these kids.
You sound quite confident. Do you feel positive that the government and the third sector is actually taking care of the orphans that need it, or do you get a sense that there are children who are not being looked after at the moment?
We're not even talking about it. We also more or less witness it. BBC Media Action do program that's, you know, governance that looks at some of these things. So we go to see what they're doing, and we go at times in some of these safe homes for the kids to see how they're being looked after. So we know that it's definitely not going to be 100%, but they're trying very hard to see that the kids live like kids and, you know, develop gradually, and see how they can, as we speak, even right now, they're training more counselors because school going to reopen very soon. And there is a whole lot that has to be done with the kids, their minds. So there's a whole lot going on in Sierra Leone now in terms of the children going to school, the orphans, even teenagers who are now pregnant, to see how they can, because they're pregnant, they can't go to school. But they're trying to see how they can have an e-learning for them, so that wherever, which homes they are, they can send these materials to them to take them through education gradually, and after which they will decide on what they want to do. But they still want them to have the formal education service so that that can empower them at some point in their life.
Thank you. Thank you for the question. Yes, lady at the back there.
Hi, you talked about how one of the vital things was the sort of changing of customs around the burial and around care. And I know I went to university, and a lot of anthropologists have been helping, you know, to communicate these traditions. But I just wondered, what do you think the kind of lasting impact of people having to, in communities, kind of change their practices has been? Because obviously these are very, very old traditions, and it must have been quite an upheaval. I mean, that's to put it really nicely.
Very good question, and that is one thing that even we used to hug ourselves in Sierra Leone. Warmly, we're one people, we love people, but it's not there anymore. Even in church, when you're sharing the peace, you don't do it anymore. When you want to go for communion, you just do a straight line, and after which you just go back to your seat, and the reverend or pastor just give a general blessing. So there are a whole lot in the mosque as well. They don't do the normal thing they used to do. So it's a whole lot of things going on, you know, changing our perception, changing our ways of doing things. But one good thing, hygienely, we're seeing Sierra Leonean, everywhere you go, you will see buckets of water to wash your hands. That has not been part of us. But with Ebola, so we say, somehow brings a lot of good things into Sierra Leone, into our communities. We now see everywhere, wherever you're going, you need to wash your hands, you need to check your temperature. So we know maybe after which it's going to take a whole lot of time for us to go back to what we've been used to, because of the period we've been doing this thing that we've never been doing. So individually as well, we got to psychologically mend ourselves, you know, think about how we're going to go through it. It's not been easy, even myself. I don't want to tell my story. But thank God for my country director, who at times when we're really down, he had to talk to us to say, it's not when you touch someone, you're going to have Ebola. Because that was the perception. If I touch you, if I'm very close to you, I'm going to get Ebola. So I was really scared. So at some point, we had a director, BBC Media Action director. She too went to Sierra Leone from London. We were like, Caroline, why did you come here? Aren't you afraid? But shows that she loves us and she wants to be there for us. And that's the same thing we too at BBC Media Action are doing, to tell others that indeed Ebola is there, but if we all listen and take the precautionary measures, there's no way you're going to get in contact with it. Coming to London has been very crazy. From what exactly, you know, testing my temperature, and at the airport we went to a room, asked us a whole lot of questions. But I'm well, I'm safe, even as I'm sitting here. As I'm done, I'm going to check my temperature.
Yeah, we can touch it.
Exactly. But, you know, amidst all of this, we're laughing today, and we thank God, because it brings us to a point where in Sierra Leone as a country, we've thought that we need to do something with our health system. It's really nothing to write home about. But with all the effort and support we've been having from CDC to the United Kingdom, you guys are amazing. A lot of money have been there through the UK government, you know, to see how you can help us to minimize the spread of the disease. And we believe that at the end of the day, we're going to sit down, we go to the drawing board and see what went wrong, and try to see how we're going to attack it whenever there's another outbreak.
Got time for one more question. Does anyone have anything particularly pressing?
Probably a question for Tulip. I was in Uganda when the Ebola outbreak kind of first happened, and there were claims from BBC World Service, people calling in saying it's being over-reported. Do you think that the kind of a slow reaction from people kind of either in the media or more listeners, kind of, did that actually not assist in kind of the humanitarian reaction to Ebola?
Yeah, I mean, everyone was slow on Ebola. Everyone, and everyone's admitted it. So World Health Organization said we were slow, we got this quite wrong. The governments have said they could have been quicker. And yes, I mean, I think, you know, and it was 3 months. Ebola was there in December, and an outbreak wasn't declared until March. That's 3 months it was able to go without anybody doing anything. So yeah, I mean, I think everybody was slow, and I think at the beginning that, I mean, but to sort of explain that a little bit, it's unprecedented in every single way. Like you said, you know, Ebola had never come to West Africa before. People weren't looking for it, and then when it happened, all we've ever seen in past Ebola outbreaks is 100 or so people die. It's so deadly that it dies out. It happens in a very remote area. It never gets to a capital. And so everyone thought it would happen like that again. I mean, this broke every single record for everything. But I think when people did get onto it, I think the international community was pretty slow. Money getting to the countries, you know, these, again, we've talked about it a lot, health systems are very weak. There's just no way in hell they could have dealt with it on their own. They needed international help. I think, again, that a number of reports have said that even the UK was slow, World Health Organization, like governments were slow. So yeah, I think that probably did have an impact, and that's why now, as fingers crossed we come to an end, but we need to stay vigilant, that you just need to ask those questions of, okay, how do you make sure this never happens again like this?
That's a good note to end on. Thank you, Tulip. We've come to the end of our time. Thank you so much. You've been a really great audience. Let's do a round of applause. Thank you.